Hey everyone, it's Sam, and welcome back to the 911 Nonsense podcast. To stay in the loop, learn about upcoming guests, and join in the conversations with the Noon community, follow us on Facebook, Instagram, and Twitter. And hey, if you like what you hear in this episode, don't forget to like, subscribe, and share. Your support means the world to us. On this episode of Noon, we're excited to introduce Alexandra, a highly educated individual with a remarkable journey and a commitment to higher education in EMS. After suffering a career-ending injury, Alex had to step away from the ambulance, but she didn't let that stop her. She pursued her PhD and is now an educator, advocating for crucial training areas like death notifications and the promotion of mental health in the field. Tune in to hear Alex's inspiring story and her passion for advancing the profession. Let's get started. All right, Alex, thank you so much for joining us on the Noon podcast. How are you doing today?
I'm doing well. How are you?
I'm doing fantastic. Thank you so much for joining us. It's been a really awesome time trying to get around both of our schedules, so I really appreciate that you've taken the time to come and join us on today's episode.
I appreciate your patience with my schedule too, so I'm glad we made it work.
Yes, me too. Can I go ahead and get an introduction?
Well, my name is Alex. I'm the creator of Emergency Resilience, which is an education-based platform for first responders. I'm also a CE provider, so I create and design continuing education courses, mostly that have been done and held in person, but that I am starting to transition more into online formats. I have a course on death notifications that has been pretty popular in the last couple of years and reached a pretty large audience, which I'm just so grateful for my community in helping get it out there. It's death communication, and I like making courses on weird topics, so the weirder the better.
That is an odd one, and we'll talk a little bit more about that, but how long have you been in EMS for?
I got started in 2003.
Oh, wow. So you've been around a long time.
A minute.
So did you always want to be an EMT or?
No, it kind of happened in the 11th hour of high school. Somebody mentioned becoming an EMT, and I was like, what's that? And they were like, oh, it's the person that, they were trying to be not disrespectful, but very, to the point, but they were like, oh, it's the person that drives the ambulance and helps the paramedic. And I was like, women do that? And this is 2003, and I was shocked that women did this because I was obsessed with ambulances as a child and watched, Rescue 911, but I never saw myself in that role, maybe because I never saw women doing it. And so when my friend, who was an explorer for one of the local ambulance companies, suggested that, I started researching it, and that was it. I decided that's what I wanted to do because I didn't want to go to college.
Oh, well, that makes sense.
Ironically, now I have a PhD, but yes.
Yes, and now look at where you are. That's fantastic. So were you afraid when you got into EMS initially that you weren't going to be able to handle like some of the blood or the guts or maybe even the hard stuff mentally?
No, and no one really prepares you for the mental hardships of it. So there was really no warning about that part, other than like the one page on, I think we talked about CISD or CISM at the time, but nothing really that I saw in action. And then as far as the blood and guts, I'm not a queasy person, but I just didn't really think I was going to have a problem with it, although I had no prior experience with it.
Yeah, no, that's fantastic. And sometimes we don't even think about it when we're getting into it, right? I think honestly, as time has progressed, I've gotten more queasy than I used to be. If that makes sense.
Is way lower.
Yes.
I'm like, I've seen it. Even when I was still in the field, I was like, nah, like we'd get, called out for a hanging, and I'd walk up and they'd walk out and be like, oh, you want to see it? Nope. They're pronounced. I don't need to see it. And I'd have partners be like, why don't you want to see it? And I'm like, once you've seen them, like there comes a point where your Rolodex is full. I've got no room for more if I don't have to. I'll save it for when I have to be there.
Exactly. What a way to say it too. That's a perfect example. why see more when you don't have to? I'm already full of all of this. And they all like, not to discredit the person or anything like that, but yeah, once you've seen it, you've basically seen it all.
Yeah. And, it was fine. I'd just rather save my energy for when I have to be present for it.
No, that totally makes sense. So how long did you, and I know in some states it's a little different, but how long did you wait before you became a paramedic?
I'm not good with timelines. I think I was 2011-ish.
Oh,
No,
you were an EMT
2011.
for a
Yeah,
long
I became
time.
an EMT. So I went to paramedic school in 2010. And my first full year working as a paramedic was in 2011. And it was, yeah, I think I spent a good amount of time working as an EMT. I got a lot of experience, a lot of 911 experience, had a lot of great mentors along the way. So it really helped set me up for success.
Do you feel like there was a push to become a paramedic? Like, did you? No, not really. Like you were
Not for
just like
me.
hanging out.
I was on my own timeline. I didn't want to be a paramedic for the longest time until I finally did, and then nothing was going to stop me. But it was one of those things that I saw a lot of people rush into really quickly,
Mm-hmm.
and I just didn't have a desire to do it prematurely. I really liked being an EMT. I felt like I was a good EMT, and I wasn't ready to start something new at the time. And then once I was ready, it was like, that's it. That's what I'm going to do.
I love that because there is such a push for people to become paramedics. And I think it's more focused now than it was, several years ago. Like I had my EMT basic for 3 years before I became an intermediate, and then I was an intermediate for 3 years, and then finally became a paramedic. Funny enough, you and I were in paramedic school the same year, just in two different schools, and became a licensed paramedic in 2011. So I was an EMT for 6 years before I moved up. And I strongly suggest to people to have that really good baseline of EMT before you become a paramedic, because now there is such a push to get that license and come out and help your community. But if you don't feel strong enough, that can be very intimidating.
Yeah, it definitely can be. And, I think what's different from the time we were coming up is that I'm just guessing, I don't actually have statistics on this, but I wonder what the workforce is like now. Like, do we have enough? Is there more of a need? At least in some areas, I know for sure there's a need for more staffing. And so there's this push and encouragement to get them out faster because they're trying to fill empty slots.
Yes. Yeah. I think we had a huge loss during COVID. I think we were having a huge loss before COVID, but I think during COVID, we lost a lot of numbers because it was scary, right? You don't know what's going on. We don't know what to expect. People don't want to worry about this and then take it home to their families or whoever. And I think we don't have a good catch up right now. We're so far behind. And I can speak for the company that I used to work for here locally. Like, we were constantly short staffed to the point where they were forcing mandatory overtime, and that has still continued. Before forcing it, they were like, hey, pick up this many shifts and you get this much cash. And you had the same people picking up overtime shifts, just burning us out, burning those same people out over and over again until it got to a point where it was forced. And I think now they're still just so short for the large city that we live in. It's kind of nuts to think about. Like the 911 situation, and I think the medical situation right now is very scary.
It's interesting because in my area, at least in the initial wave of COVID, they were laying people off left and right. That was actually around the time that I got cleared back to work, and I attempted to apply for my old company because I'd already resigned because it was taking too long to get, back to full duty. And I'd moved on to another job, and I tried to get a job left and right. And they were like, we're not hiring right now. We're actually laying people off because we were so slow in that first initial. So it was really interesting to see polar opposites in just depending on what part of the country you were.
Yeah, like and in the first probably couple months, it was slower than it had been, and it just blew up. It was
Yeah, it
crazy.
didn't stay slow for sure.
So you said that before we started recording that you had a back injury. Do you feel comfortable talking about that back injury?
Yeah. Actually, this is a great time to offer a PSA that if you injure your back at work, to document it. even if you do nothing else, because that was kind of the big thing when I was there, which is that I worked for a private ambulance company at the time. And, you know, you always got asked, okay, you know, write it up. And do you want to go to comp, which was workers' comp? And, you know, basically they would prescribe you like 800 milligrams of Motrin and maybe do an x-ray, maybe put you off on work. And like, I didn't want to do the whole thing, but so I always kind of avoided it. And I'd heard it before, like tweaked it here and there, but this time I did a number. And I was just like, my whole muscles like locked up. And the next day, what I was supposed to work the next day, which was a holiday. And at the time, this was back in, I think, 2012, maybe 13. But at the time, we were so low staffed that if you called off on a holiday, you got an automatic write-up. Or even a final, maybe, I don't remember, but there was some sort of penalty. And I had like no write-ups on my record most of my career. I think I had one as an EMT. And so I was like, nope, I'm not. I liked following the rules. I liked staying under the radar. I was not one to, at least anything that led to paperwork, I was not one to give my supervisors a hard time. And so I went into my supervisor's office at the end of the day. I said, hey, I need to write this up because I need to call off tomorrow. He's like, you want to go to comp? And I said, no, just write it up. And it wasn't until, if I'm remembering, all my years are blurry, so I apologize, but I think it was 2017, if I remember correctly, that it went out completely. Like I just immediately had, and it was unprovoked. But the way it was described to me is that you can live with a herniated, because I had a herniated disc. I had my L4, L5, S1, L4, L5. I call that the EMS special. Most people in EMS have something wrong with those three discs in combination. And the first two, I had a bulging disc, and S1, I had a herniated disc. And basically the way it was explained to me is that you can live asymptomatically with bulges and herniations for a long time until you can't. And all it takes is the weight of an eyelash to just floor you when it comes to your sciatica, which was what happened to me. So I was fine until I wasn't. And I called my primary doctor because I couldn't feel my left leg. And so I called and I said, I need to get an appointment. They were like, and it was a new doctor, and they were like, oh, we've got something a month from now. I said, I can't feel my leg. They're like, well, come in tomorrow. And I said, well, I'm lecturing tomorrow. I was teaching that day. I was teaching at that time at the college. And they said, you either come in tomorrow or you need to go to the ER immediately. And I realized, oh, I guess this is a problem. Like, I'm not even, as a paramedic at this point, and as someone who'd been in the field, I'm not even putting two and two together that this is bad. Like, I'm in such denial.
You're in your head, you're like, this isn't a stroke, right? I'm not having a stroke, so it's not that bad.
Yeah, exactly. And so I was like, okay, fine. And so, but at this point, I can't walk, I can't stand, I can't sit. I'm in excruciating pain. And so I go to my primary, he orders an MRI. And he calls me as soon as he gets the results and says, this is an old injury and you need to go to your work about this. And I didn't understand. And he goes, that you did not do this today. This is cumulative. You've been herniating for a while. And I was like, okay. And so I went to my supervisor, and my supervisor was great. My company took care of me. I know there's a lot of really poor experiences out there, and I completely believe them. And I expected that out of my company, to be honest with you, but they took very good care of me. And so he said, look, he goes, we'll start the workers' comp process, but the second you start it, you're going to have delayed care. So he goes, I want you to get your initial like treatment from a specialist, so you can get medicated, you can get like cortisone shot, like whatever I needed. And then he goes, then we'll open this up. And I said, okay. And after about 3 weeks of making appointments with a neurosurgeon and having the appointment canceled for whatever reason, it was, they're not seeing new patients, they're no longer in practice, they had a family emergency, they don't take my insurance. I was screaming on the phone by the end. I was so frustrated and in so much pain that I finally went back into my supervisor's office. I said, workers' comp cannot be worse than this. And I was wrong. So I went to my workers' comp and I saw the PA, and I showed him my paperwork, which said, you know, it showed the bulging and like they use certain words and terminology. And I remember Googling it, but not really comprehending and understanding what I was looking at. I can't read an MRI. I don't understand what these things mean, or I tried to as best as possible. I do now. And so the PA just kind of looked at me, and he's like, yeah, he goes, bulging discs, he goes, everybody has those. He's like, you're not you're not anything special. And he goes, spinal stenosis, which I was really freaked out about because spinal stenosis sounded permanent, like it's something you live with for the rest of your life. And really what it was the disc that was protruding the canal was causing the spinal stenosis. So it was a reversible spinal stenosis of the crowding of the canal. And he's like, yeah, spinal stenosis. He goes, my mom gets that from watching Wheel of Fortune all day on her couch. Mm-hmm. And I'm like, is this guy for real? Is he serious? Like, I'm in pain. I can barely walk. I can't feel my leg. I just need some help at this point. And so I said, well, can I see like a neurosurgeon? He goes, you don't need a neurosurgeon. You need an orthopedic surgeon. He goes, which I didn't know is like they can do the same. Basically, both those surgeons can do the same surgery. I didn't know that.
I didn't know that either.
Injured person at this point. And he goes, well, I'll put it in my notes for an ortho consult, but as soon as they see my notes, they're going to deny you. So I'm clearing you back to full duty.
So you can't even move your left leg like hardly at all at this point. And he's like, okay, see you later. Bye.
So he leaves the room. He comes back and he goes, well, I guess I should do a physical. And he goes to like lift my leg up. He goes to lift my leg up and he can't get, my knee can't extend. And he kind of looks, he goes, huh. And he goes like, he feels my quad to make sure I'm not stiffening it because he thought I was faking it. And he goes, you're not stiffening it. And I said, no shit. And I am at the point where I'm so broken. My spirit and my mind and everything are so broken. I have no fight in me. I'm just like, if I speak up, I am just going to cry. And I'm not about to cry in front of this man.
Yeah.
And so clears me back to full duty. I go to my supervisor's office and I just break down. And he goes, I am not putting you back on an ambulance. And I was like, thank you. And so luckily my supervisor took care of me where, you know, workers' comp didn't. And a week later, I had an appointment with the orthopedic surgeon who apparently was willing to see me. And I walk in, not expecting much, especially because I figured it's another comp clinic. It's just in another city. And I'm expecting the same treatment. And I walk in and the surgeon says, well, I can see why you're in so much pain, Miss Jobber. And I said, why is that? And he goes, you have the largest herniation I've seen in my career.
Ooh, that's not good.
Not something you want to be number one in, I'll tell you that. And I said, but I thought it was 2.3 millimeters. He goes, I thought you were a teacher. It's 2.3 centimeters, which is 23 millimeters. So he was a shit talker. I liked him immediately. And he says, you know, he looks at the 23. Now, anything over, if people aren't familiar with a back injury, which I hope everybody stays as unfamiliar as possible, but anything over 7 millimeters is considered large. Mine was sitting at 23.
Jeez.
And I said, he goes, what's the problem? Because I said, I just look shocked. And I was like, well, the PA at the clinic basically told me this wasn't remarkable. And he goes, well, that's why I'm a surgeon and he's a fucking PA.
Oh.
I trusted that man with my life immediately.
There you go.
Immediately. So that was the start of a very hefty redirect, we'll put it that way. So I ended up getting surgery several weeks later, a couple months later, actually. I was pretty stubborn about it because, you know, they always say, and I listened to the, you know, the fear type stuff of you're never the same after back surgery. It's like, you're never the same after a back injury either. I would just much be out of pain. And he documented it very well. He documented that I was eligible for the biggest surgery, which is like a spinal fusion. And he documented that I was eligible for the biggest one and that I was a candidate for the biggest one and I would need the biggest one, but that he was going to start with the smallest one. So least aggressive to most aggressive. And workers' comp approved it immediately.
That's amazing.
So it was me that was hesitating. And finally I herniated it again because I was like coughing. I choked on some water and now I had numbness down my right leg instead of just down on my left. And he looks at me and he goes, because they're not supposed to do this. They're supposed to just be there as like, you know, there's stuff they weren't supposed to do. So number one, he gives me a cortisone shot, which I don't think he was allowed to do. He just did it and was like, screw it, you need it. And because like you have to go through approvals and stuff like that and whatnot, hoops that you have to jump through. But he saw me in pain. He gave me the shot and he goes, you're stubborn like my sister. So I'm going to tell you what I told her. Get the surgery yesterday. And finally I got the surgery. So that was the start of my recovery, but it did take a while to fully rehab.
And how does a rehab look for a surgery like that?
You know, they have you do a lot of stupid exercises that like I didn't think were really that great. In hindsight, you know, there were a lot of things that I probably could have done better had I had a more aggressive PT, physical therapist, and had I been more compliant. I think there were things I probably could have done better when I stop and think about the fact that, okay, in hindsight, like if I'm being fair, I walked in thinking this is stupid because it's so slow. Like physical
Yeah.
therapy, so sleepy. And you're just like, when you're used to doing way more, I mean, at that time, I wasn't super active. I've never been super athletic or active, but I was just like, this is it. Like, it felt like I was doing nothing. And so mentally, it just wasn't really clicking for me. So that definitely was my bad. But the problem was that the nerve had been so damaged, I still had numbness. And so, like, 90% of the pain was gone, but I still had a very sore back. I still had inflammation. I still have a numb spot behind my calf, and I still had numb toes. So there was still trying to find the combination of things, plus just waiting, giving it time to heal was what needed to be done. But I finally found that doing a spinal decompression table was one of them. So not the ones that lay you upside down, but like that you're strapped in and like this whole thing, and you actually sit on a table that does this with your lower and upper body. And I did that, and then I ended up doing some like sound wave therapy, and that ended up being like the magic trick. But it took about a year before I found those two modalities. So
I've never heard of sound wave therapy.
it's sound wave or light wave. It's one of those, but it uses like an impulse thing, and it doesn't hurt. At least it doesn't hurt me. But the front desk lady, the manager, office manager, was like, "Men always scream, women handle it at the highest level." And I was like, "Okay."
So you said that you had this injury in 2012?
Documented 2012, but the exacerbation of it, I guess, or the manifestation of like its bigger problem was, I think, 17.
Yeah. Wow. Good job for documenting it because that is insane. That is insane. That's crazy. I'm so glad that they didn't give you any like crap about it and they just handled it. That's really impressive for that company. Good on them.
Oh, and it's a big company too. And I think it was honestly the way my surgeon documented it. You know, he didn't try going for the biggest one right away. He documented like a lawyer, to be honest with you, I felt like. And so it took about 2 more years. So it was like, I want to say late 2019, because it was 2020 that I started applying for jobs again. And I couldn't get any.
Oh man. So you've had this injury and I don't know much about your life outside of stalking you on Instagram, but how did you survive in that time that that you had the surgery and you're trying to recover?
Oh, it was a very, very dark time for me. I was very depressed. I was drinking a lot. Just coping with alcohol, coping with food. Um, I think I'd just gotten a Fitbit at the time, like a few months prior, and it was just so pathetic to see like only 700 steps at the end of the day, because that's how immobile I was. It was like I literally would get up and go to the bathroom, and that was it. I couldn't shower. I'd have to choose between, okay, I'm washing my body or my hair today. I'd have to take a break in between. I'd have people driving me to work, so that if I had to take, which I only had to take a narco like once or twice, I found that narcotics didn't really help me. But yeah, it was a very depressing time, and everything changes. And something I don't think people realize is when you're injured like that, it's so distracting. You can't think of anything else but your injury. You just focus on it. You move, and like, is it still there? Is it not? Is it getting better? And you're researching it, and it just consumes every bit of you. I probably didn't have good boundaries with myself, and like constantly worrying and thinking about it. And unfortunately, another thing that I think gets overlooked is how much physical injuries will uproot psychological ones. So for the first time since I was a kid, I was having nightmares that had occurred when I was under the age of 5 was now occurring as an adult. And I think I know it was the back injury that caused them to come back up.
That's interesting. Why do you think that was just because you were so depressed? It was kind of just like sucking everything out of you that was causing these nightmares?
No, it's hard to say which came first. I mean, the depression was kind of a slow roll. I've always had a history of it, and it's come in waves. And I think I was, when I look at the depression I experienced from my back injury, it's like that doesn't need to be fixed. Like I understand why I'm low. I understand why I'm in this dark place. Like I need my injury to be fixed, and then I would have been better, kind of thing, is where I was at with it. It wasn't like this unexplainable, like, why am I feeling this way kind of situation. But pretty shortly after the back injury, I had my first nightmare. And the problem with it was always spiders in my bed.
Hmm.
And so jumping out of bed abruptly in the middle of the night to turn on your light when you have a back injury that you move like a grandma. Otherwise, it just made, I mean, I just was in pain nonstop. So, and there was no preventing those.
Yeah, it really is sad the high percentage of back injuries that are taking EMTs out. You know, that it's like the number one reason for EMTs and paramedics getting out of a job is because of an injury. And it's not just it could be a little injury, it could be a big injury that is enough to make it so that you cannot do your job anymore.
Oh yeah, it doesn't take much. So I tell people document it, even if you think it's nothing.
Yeah.
Because the other thing I didn't realize is that a disc nerve issue, it felt like muscle pain. And it probably was muscle pain because my muscles were locking up to try and prevent me from moving. So I just thought, oh, it's a strained muscle, and I wanted to like dismiss it. It's like, no, it's probably your disc. It's so common, it's probably your disc. Just write it up. Had I not had that documented, my surgery would not have been covered.
That is insane. Like something that's so small too. Just,
And
hey,
these
write it up. I'm
surgeries,
good. Yeah.
yeah, exactly. It seems so inconsequential, but these surgeries range from like 35 to $100,000. So do
Yeah.
not skimp on documenting it.
Oh man. Well, I'm glad that you were able to do that. You were kind of mentioning about how Norco didn't really work for you, and at the time that you were drinking a lot, did they allow you for your 40 hours of light duty? Is that why you were going into work?
Oh, so I was advised to bypass the 40 hours of light duty because I made a lot more money teaching at the college. And that was another thing that my supervisor said. He goes, I'll give it to you if you want. He goes, but I know what you make at the college. And if you take light duty here, you can't work up there.
Okay.
And so, and I wasn't full time at the time. So it's not like I was losing out on benefits. So I just worked at the college. And so it was always friends. So when I said I had friends driving me to work, they would pick me up and we'd carpool together, but I would just lay down basically because I couldn't sit up.
So how did the back injury inhibit your teaching?
I had to roll around a really ugly like backpack on wheels. And anytime, the first time I got up there, I didn't know what was wrong with me. This was before I made an appointment with my doctor. And I couldn't even get my boots on by the time I got up there. So I taught in sandals and slippers. And two of my students actually drove me home. One of them they carpooled together. They lived in the same city as I did. And this was about an hour away from where we worked and where they
Wow.
attended school. And one of them drove my car and the other one followed behind, and they both got me into my apartment. And yeah, that class really took care of me. And so I mean that my coworkers as well. Like I dropped something and there would be three people running to pick it up, so I didn't have to.
Oh wow, that's
Yeah,
impressive. And that's really cool that they were willing to do that for you.
they were great. They were great. I think it would have been a lot harder if I didn't have that job. I would have gone pretty mad.
Yeah. And were you teaching EMTs or what were you teaching at the time?
Mainly paramedics, but I picked up shifts with the EMTs at that point as well because I had the time. I didn't have any, um, you know, days. I used to work, do a mix of both on the ambulance and teaching, and I loved that combination. And it got really hard there for a while to not have a break from the college to work just at on the ambulance, and that was a really hard transition. But I can see now that I've made good with the direction I had to go in the redirect, but man, it was a difficult time.
And that pushed you to further your career, right? You ended up getting a bachelor's and then you moved on to a master's.
Yeah, I want to say if I remember correctly, again, I'm the world's worst historian of my own.
That's all right.
If I remember correctly, I was either about to finish my bachelor's when the injury happened, or I think I had already applied and gotten accepted into my master's, which was at the same college that I finished my bachelor's. I want to say I finished my bachelor's already by the time the injury started, but I didn't walk because I couldn't walk. I physically couldn't go to my graduation. So I skipped my graduation because of the injury. But I think I had already completed my classes, if that makes sense. Because, yeah, the graduation would have been in May. I got injured in March.
Oof. And what did you get your bachelor's in?
Public safety and emergency management. It was a big fat FEMA class. It was nothing
Big
but
fat FEMA class.
just disasters and FEMA certs and the world is ending. And no, I'm just kidding. I actually learned a lot in it. I did all my risk assessments on the city I lived in, and I was like, wow, I really understand this, risk of flooding. And then there would be these, taxes that would come up that they wanted to tax the city X amount, millions of dollars to fix this and this and that. And I'd be like, yes, tax us, like, because the damage that's going to happen from, a 100-year flood is going to be far exceed this. Like, it was interesting to understand the why behind some of these initiatives and, people, not wanting it for either taxes or because we lived in a historical city. So there were things they didn't want to touch that were like, this thing is contributing to our flooding every single year. It's just going to take one bad year to wipe out all of downtown, which was full of small businesses. Yeah. And so it really changed my perspective on a lot of things. And I did enjoy that part. That part was fun, but I hated the rest of it.
That's really cool that you got to be that involved in your classes. When I did my emergency management class, we actually had to read World War Z, and then we had to make a plan based on if zombies attacked.
Stop.
I'm not kidding you, dude.
That's kind of fun.
It was a lot of fun. It was a lot of fun. I really enjoyed that class, but I think I was in one of the last years that they actually did that. But it was really cool. So I'm glad that they got you as involved as they did. That's a really neat experience for you. A lot of your bachelor experience sounds very similar to a lot of my bachelor's experience. So what did you go on to get your master's in?
It's technically in mental health with an emphasis in grief and bereavement and a focus on, my focus was death and first responders. So one thing I loved about my master's that I only got in a little bit of my bachelor's was the autonomy to really kind of choose your own adventure, is the way I call it. So a lot of people around me had their master's degrees at the college that I worked at, and every one of them said the same thing. They said, your master's is 1,000 times easier than your bachelor's. And I asked them why, and they said, because there's no bullshit. It's just straight to the point. It's all focused. You don't have to get, a math class and a Spanish class and all these other things that you're not trying to get your degree in. It is entirely focused. And so I trusted them and I was like, okay, why not? And I was debating between becoming an MFT, so a therapist, or getting this degree. And I was like, well, I take an interest in death notifications, and this would give me the confidence I need to kind of create some curriculum around it, because I know that's not something we have in our industry. It's not a national standard, nor is it something that's expected to teach any level of EMS about death notifications. It's, all about intercepting and intervening death, but not what to do when it actually happens and there's nothing more that can be done for the patient. So all my assignments, everything circled back to EMS. And that's what I ultimately went on to build the curriculum that I now teach on, was based on that master's program.
That's crazy. So what prompted the death notification process? Like, what made you so interested in that specific subject?
There's a number of things, but the big one was when my mom died when I was 18, very suddenly. And I was tasked with telling her best friend, and I shit the bed on that. It was not a good notification. I even knew back then, like, I don't know any better. Like, nobody taught me how to do this. My sister asked me, hey, can you do this? Because she was busy calling everybody else. And I was like, yeah, I got you. Like, no problem. She didn't ask me to do anything else. So I felt more than happy to call her friend. Happy is a relative term, but I was more than happy to help my sister out, even though I was nervous. And then, that whole thing went sideways. And it was right before I started EMT school. I went to EMT school at 18. And I remember, like, because I mean, at that point I'm crying, her husband's yelling at me, it's this whole thing. And I remember thinking, like, oh, it's okay, like, I'm about to start EMT school in a couple of weeks and they're going to teach me everything I need to know about how to do it right next time. And usually if I tell an audience that, I give them a second and they all start to laugh uncomfortably because they're the same way.
Yeah.
You know, I got into medic and into my internship and I had some big realizations that, wow, nobody taught my teachers how to do this either, because I watched a horrible, like, completely non-existent death notification where the guy just, you know, circumvented the topic altogether. He had to call somebody. And I was just like, what is going on here? Like, nobody is teaching, like, nobody has taught my teachers, and no one's going to teach the people that are coming after me. And I wish I could tell you that was like kind of my moment and I decided I was going to do better at it. And it's like, no, I just followed suit. I just learned how to avoid. Yeah. And I think I just avoided until the EMS gods had, you know, their way with me and kept putting me in situations I couldn't get out of, where the patient was kind of almost dead, but not really dead. And the family was there, but they were DNR, but they didn't want to give the paperwork and we had to talk about stuff. And so I had a lot of those experiences. And, when I decided to go through my master's program and I was going between the two, I was like, well, I've got a lot of experience with this. Like, maybe I can finally create a class, because I was already teaching at that point. I started teaching. I taught for a few years before that, like, just intermittently, but I was teaching consistently after 2014. And I thought, well, we don't make time for this in the medic program. Like, maybe I can create something for us. And that's where that idea was born.
Now, is that, I know you said that you teach a lot of your CEs in person, but is that a class that you offer online?
That's my kind of main class. That class I actually released in 2021. So it is due for an update, which I do the more updated version in person, and then I'm going to be re-recording and reproducing it and re-releasing it. I don't want to say when, because I don't know when that's going to happen, but that's the plan. It's like on my immediate list is to relaunch that course and update it, but it's still good. I mean, the information in it is still relative and It's still up to date. The references are still good. And I'm very grateful, but I've had, you know, students from all around the world. I just got somebody just took it in the UK, another person in Ireland. Yeah, all over. So
that's fantastic. And I'm going to look into that. That's really cool. So did that prompt you to then further get your PhD?
Yeah. Yeah, at that point, I realized, wow, if I can do this with my master's, then, you know, what could a PhD do for me? I had no idea what I was getting into with a PhD program. A PhD program is a whole different beast. So, yeah, I decided to get a PhD in psychology, and the psychology degrees in integrative therapies and healing practices. So it's non-clinical based. You just kind of find ways that you integrate that work into whatever it is that you do. And for me, it's education. And so a lot of it is to take these bigger concepts and kind of I want to translate it into digestible information that a broader audience can understand, especially, or relate to, not even understand. Like, I'm not trying to dumb it down, so to speak, but I'm trying to make it relatable. How do I take these bigger philosophical, psychological concepts and make it relatable to the boots on the ground paramedic and EMT?
Now that totally makes sense. And I'm so glad that we have such a big advocate with you doing all of this for EMS, right? We don't see this very often, because people get in, they get injured, and then they have to find something completely different usually, or they just decide they don't want to do with EMS anymore because they're so burned out from it. You said that getting your PhD was a whole other ball game. If you had the choice, would you choose a different path?
No.
You would have still gotten it.
Yeah, I hesitate to say I'd do it again.
Because it was that bad, yeah.
But would I do it once? Yes. Would I still pick the path I did? Absolutely. Would I do it twice? No.
And has getting that PhD opened any other doors for you?
Yeah, it has. And so it's funny, I don't really, and I even did this when I was working as an EMS, equivalent of an EMS coordinator, they called it specialist at the time, with the fire department, around the time I had my back injury, right after my surgery. And you know, everybody, and no judgment at all. Like if people put up their degrees and stuff, I think it's a wonderful thing. I can't wait to have an office of my own. We don't live in a big enough place to have a home office, but I would love to display all those very expensive pieces of paper. But that just wasn't a place I needed to do that, because the people that came in to talk to me, they weren't going to be impressed by those letters, like the old English and the,
yeah,
fancy lettering and stuff. It's like, what do they care? They care that I was a medic. They care that I'm still a medic. They care that I've done the job. And that's what I wanted them to see first. And so, when it comes to connecting with the people, I don't lead with the fact that I'm a PhD. I'll put it in there. Yeah, I love I paid a lot of money for those letters. Those are going on my names and post nominals, but it's the administrators, it's the people at the top that are starting to take notice, that will hear me because I have those letters behind my name. And I've had conversations that I don't think I would have had opportunities for, whether it's because of my confidence to approach those individuals or those organizations. I don't know. It may be a combination of the two, but having a PhD does open doors.
Well, and it looks fantastic on paramedics, right? Like, how many paramedic PhDs do you know?
I know. So the one I knew growing up, quote unquote, in this field was my pharmacology professor, my instructor, Dr. Holbrook. And a lot of people from my area, I went to school, I grew up and went to school in Southern California, but that was the area that I worked in the field. And those who know Dr. Holbrook know exactly who this man is and how brilliant he is, and how he was just very extraordinary. He stood for a lot of things that, just made him stand out apart from a lot of other people. And he made you think. He really made you think. He taught ethics and pharmacology. And so when it came time to build my dissertation committee, I was talking to my chair. Her name was Pat, and she said, "Well, you've got me and you've got so and so." She goes, "You need an outside reader. Who can you think of that's PhD level that maybe understands pharmacology?" Because she's like, "I sure don't." And I was like, "Oh, Dr. Holbrook." So he was actually my external reader for my PhD.
That's really cool.
So that was really cool. So he was the one I knew. Other than that, there are a couple that I've connected with on LinkedIn and that I've seen, at conferences. So we do exist. It's a small network.
It is a very small network.
For sure. And I know one that's in their PhD program. So it's really cool to see though. But, it's always been this idea that, and I very much embodied that idea for a long time. I went to become an EMT because I did not want to go to college. I became a paramedic because I did not want to go to college. And yet here I am holding both the highest degree you can get in college and the one that I wanted to rely on. And that got me pretty far in life.
Yeah.
My paramedic cert, I'm very, very, I'm equally as proud of that as my PhD.
That's great. And you should be, right? That is a hard certification. It's a hard license to get.
Thank you. Yeah, I'm never letting that thing go.
Don't.
I keep it up. I mean, I did let my national go because I couldn't afford it. Like, I was like, my God, I'm so out of money by the time I'm done becoming a paramedic. You want more money from me? No.
Yeah, no kidding.
Something had to give. So unfortunately, I let that lapse, but I've fantasized about taking my NREMT again, just to see if I could pass.
It wouldn't be too hard for you, I don't think.
We'll see.
You do have your PhD.
I used to. No, yeah. It's definitely not the same. I don't have a PhD in paramedicine.
It just means you know how to study.
That might be true. Yeah.
So now that you have this whole collection of very expensive pieces of paper, what do you do with it?
I create my own courses.
Okay, like for CEs?
Yeah, I do. I don't like, and even my death notification course, it's not all doom and gloom. It's not this depressing topic of conversation. Yeah, it's going to evoke some emotion. It's going to make people reflect. It's going to challenge the provider to explore what their own relationship with death is and their own discomfort with it. Because a lot of times our avoidance of death notifications is indirect or directly reflecting our own discomforts with it.
Yeah.
And so it does a lot of that. But yeah, I guess there's a lot I could do with even my bachelor's degree. I could go do some other stuff, but what I really love doing is I love creating content. I love creating courses. So I've been teaching courses. I love creating courses. I want to create more that go online. I produced my last course. So the first course I produced, I didn't produce it. I paid a company to produce it for me. And this last course that I just released, I produced it. And it was kind of a litmus test for me to decide whether or not it was something I could pull off, and it was. So I'm actually in the process of creating my next online course. And so I just want to continue creating online courses. I want to create courses that are entertaining, that are refreshing, that are, unique topics. So my PhD that I wrote my dissertation on was ketamine therapy. And so I want to do a class on ketamine therapy, different things like that. So, that's the bigger push that I'm going for right now.
That's really cool. Do you plan on building like a full refresher for paramedics or EMTs or anything? No?
I don't think so. No. And I mean, there's a lot of great refreshers out there. There's a lot of people that do great work. And I'll be honest, like there was a time where I knew a lot about cardiology. Pharmacology was my jam. That was the topic I taught the most. Pharmacology, med math, and manipulation were my favorites. And I'm not saying that I don't still find it interesting. It's just not where my heart is. I want to do more of the psychosocial stuff. I want to talk about the solution-based topics, especially the ones that a lot of people don't realize are legally accessible to them right now, which is ketamine. That's why I'm such a fan of ketamine therapy, is because it is legally accessible. It behaves like a psychedelic. It reprograms the subconscious, and it goes a lot further than talk therapy ever will for us, especially in regards to trauma. So that's the kind of stuff that's where my energy is needed right now. And so while I'd love to teach the bread and butter stuff, I have other things that are kind of higher priority right now.
Yeah, no, that totally makes sense. So is ketamine therapy something that you've actively participated in?
I started it last year. I did if I remember correctly, I did 6 sessions total. My last one being a couple months ago. I can't even remember when I last got my last one. We were living here, so it would have to have been in April, I think.
Can you walk me through what a ketamine session is like?
So for myself, now everyone's going to be slightly different just depending on where they go, what they do, kind of how they integrate it. But the place I was going, you get there, of course, you have to go through an intake process. It's completely legal. You have to get it prescribed by a physician. You have to, meet qualifications and have to do an intake and all that stuff like that. You don't just sign up for a ride and go for it. You have to find out if you pass all the stuff and the what do they call it, the medical screening. And so we scheduled a day that my boyfriend could bring me. And so we go in, and they'll start off by doing like a check-in, and I would do 5-point acupuncture in my ears. So that really helped the nervous system kind of bring me down. I'm actually going to do that today at a friend's studio. We're doing 5-point acupuncture ceremony, which is just like, there'll be like 10 of us there getting acupuncture, which will be really neat. And but that was how I started my ketamine. And then they would get you all hooked up, so you have to wear an SpO2. You've got blood pressure cuff on your wrist. What else was it? I think that was it for the vitals. And then they would start an IV, and I would get an IV infusion of the ketamine. Now, I don't know where it is where you work, but most people are familiar with getting, let's say, here's one example, is 0.3 milligrams per kilogram, max of 30 milligrams. They infuse that usually over 5 minutes for pain. My infusions were over 60 minutes. And my first infusion was, I think, 0.2 milligrams per kilogram. So you can imagine if I'm having this immediate hallucinations. I remember coming out of it going, holy shit, people are getting that over 5 minutes after like a car accident. Like, no wonder they're going ape shit in the back of the ambulance. You're sending them to space without any consent whatsoever. Like, no wonder. Then don't get me started on IM. I did IM ketamine once, and that knocked me off my ass. I had no idea IM would work as fast as it did. I expected it to work so much slower, and that was a very rough ride.
A lot of people are really partial to ketamine for pain. I feel like I prefer, as a flight medic, I prefer to give ketamine for people who are sedated. Like we're sedating them with the ketamine to knock them out because, like me personally, I would not want that kind of a trip. I don't think I would handle that very well. But that's just
Yeah.
me personally, and it's probably because I feel this way that I would cause a bad trip, but I don't want it.
Yeah. And do you mean trip by the flight or trip by the
Like
like
the head trip. Yeah.
yeah. Yeah. No, there is a way to bypass the trip by just giving them more.
Yeah.
It's yeah, and so the intent of the experience is, for me anyways, the experience was very, there is a way to get IM ketamine in a more smoother, where they cut the dose in half and you do half now and half, 15 minutes later. That was not what we did this time, which I learned my lesson. But the IM, you just kind of feel yourself lifting, you float. And that's another thing people don't realize, is that it's not all visual disturbances, like hallucinations. There's like 6 or 7 different types of hallucinations. And the most common one is this proprioceptive, like feeling of, this feeling of floating out of your body. And, I kind of felt like my hand was numb. I don't know. There was a weird like sensation. It didn't feel like numbness, but there was like very little, like if I touched I was like, oh, is that my leg? Kind of had this, it was tactile. It was very tactile. That's what and you can have, scent hallucinations, auditory hallucinations, and, the biggest one being the floating. And so, yeah, people hallucinate very quickly on this medication. And if you're not prepared for it, and you're not like anchored in your mind, like I'm safe, this is okay, this is what's expected, then yeah, it could turn sideways real fast.
Yeah, it doesn't help either that I think my very first like experience with watching somebody get ketamine, they were cutting she had been skin popping, so they were cutting it and cleaning it out. And my my preceptor was like, "Hey, come watch this." And this was my very first like paramedic in the hospital day, seeing what it's like. And they gave it to her, and right after they gave it to her, she was like, she sat back, her eyes wide open, and she starts screaming, "I'm in space!" Just like, oh my god, I don't know if I could handle that. So were
Yep.
you using it for pain, or were you using it for like PTSD or?
I was using it. I had a lot of intrusive thoughts and anxiety at the time that I went in for it. I wasn't having any depressive episodes. My depression kind of comes and goes. And I would say that even though I didn't go in for depression, it was initially studied. So ketamine therapy in early 2000s was initially studied for treatment-resistant depression. Now, it has been prescribed off-label for multiple different conditions, all inclusive of PTSD, depression, anxiety, substance abuse, OCD. Some people with TBIs will do it after 2 years post-injury, depending on their clinician. A number of things people have used, because what they're trying to do is they're trying to heal the wound, the psychological wound, the psychological trauma that causes, that's attached to these manifestations of that injury. And so for me, even though I didn't go in for my depression, it's helped it significantly. And I've had a depressive episode since then, but it was very short. It was very short, and it was very, quick to resolve. Whereas previously they would last about 5 or 6 weeks.
That's crazy. So how do you compare like ketamine therapy to the mushroom therapy?
So well, I guess the biggest comparison is one is legally accessible and the other one is not. So I'm very careful not to promote. I'll talk about educational wise about what these different psychedelics are, particularly as different parts of the country petition to decriminalize them. But I'm very careful to speak specifically about ketamine therapy because it is a legal option that people don't have to worry about what will my employer think, blah, blah. And I always say, well, if you had oral surgery and your doctor gave you narcotics for the pain, would you be worried about going back to work the next week? Well, no. Okay, it's no different. It's just, because it metabolizes so fast. I mean, you're sober within an hour, and I was often off to my day after that. We went to dinner afterwards. Like, you're not incapacitated by any means. After the infusion stops, I mean, it metabolizes so fast. And so as far as how it compares, they're just for different things. So psilocybin is the active ingredient in psychedelic mushrooms, and it's obviously a plant source, a natural source versus a chemical man-made source. And so there's that to consider. It's a little harder to find a credible source, and to make sure that you're taking the right amount, you have to measure it in grams. There's all this stuff, and different grams are going to respond differently depending on the person. And there's microdosing, and then there's hero dosing, and so there's just a bigger spectrum of, I guess, options when it comes to that. And no matter what people choose, like, I'm not here to discourage people from using mushroom therapy. I know people who do it, and I'm not against it for myself. But the thing that I think is most important when it comes to any type of psychedelic therapy is that it has to be done with a professional or with a guide, an experienced guide that knows what they're doing, that is going to remain sober during that time and facilitate that experience, because they can be very scary to explore on your own.
Yeah, and they have legalized it in some states, right? I think in Colorado they do microdosing, and I think in Washington or Oregon they also do it.
It's weird. It's weird because you'll have like one city in a state that decriminalizes or legalize it. Like I'm pretty sure Colorado was the first to legalize it, but like I don't see it being sold anywhere. Like there might be, but there's, legalization means technically, I don't know. I don't understand it, and I've tried to go down the legislative, like rabbit hole with it, and it just doesn't make any sense. I got really frustrated with California because California had it on the bill, and I wrote about this bill during my dissertation, so I was very familiar with it. They were going to decriminalize ayahuasca, mescaline, which is the active ingredient in certain cacti, and psilocybin. And I don't remember if there was going to be a fourth one in there, but those were like the main ones. They were all plant-based medicines. They weren't things that you could find. It wasn't like MDMA and LSD. They tried to put that in there, and they went back and they said, no, you got to take that out. So they took it out, and then it got all the way to the governor's desk, and he said, no, got rid of it. And we're like, what? And so they were like, well, now he wants it to be legalization. And I was like, okay, that makes sense, because there's an insurance company that's in his back pocket that's saying, hey, we want this legalized, so then we can get our fare in it. And then it went up for review under legalization, and that got dropped as well. So I'm like, what do you want? Like, why are we guessing here? But then there's different counties within the state of California where it's decriminalized already. So I'm like, yeah. Huh? I don't understand any of it. So I try not to waste too much of my energy on that. Just be careful. That's all I gotta say.
Yeah, have somebody with you. Be present.
Be safe. Right? Don't get yourself in trouble. Know what shows up on a drug test. Ketamine probably won't, because it metabolizes so fast, and they don't test for that in standard employee drug tests. But you never know. You gotta be safe about it.
So how do you feel about the legalization of marijuana?
I don't feel either way about it. I mean, I honestly, I guess what I can say about it is that I feel very strongly about body autonomy. Let people do what they will do with their bodies. Let them ingest what they will ingest. And yes, you could say an argument of like, well, what happens if this and that? It's like, Colorado did a pretty good, I sat in on a presentation at the psychedelic conference last year where they talked about the statistics of how many calls, 911 calls, police, that they had related to substances once that decriminalization, legalization thing took place. And it was almost negligible difference. It was the same kind of, like, it was almost like, just let people do what they need to do. Like, I don't use cannabis therapy. I know there's a lot of therapeutic effects. for it. I don't understand it. I don't study it. I have a friend who's very well versed in it. She actually got a nursing certificate in it. She's a nurse that got a special certificate in cannabis, which was really cool. So she's my go-to person with a lot of stuff. She understands the cannabinoid system and different like effects. Like some people use either CBD and even THC to help with Parkinson's, and I mean, it's really remarkable. So I know there's a lot of benefit. I've heard there's a lot of benefit to it, but I've not done a whole lot of specific research to say one way or another.
Yeah, no, and I agree with you. I think allow people to do what they want to do to their body, right? As long as they're not harming other people.
Exactly.
Did you say psychedelic conference?
Uh-huh.
I've never heard of that before.
So MAPS, which I don't know what it stands for. It's like something discipline. I don't know. But MAPS is like, the way I describe MAPS is the AHA of psychedelics. They are like the American Heart Association of Psychedelics. They're nonprofit. They're the leading experts. They run all the studies. They were really spearheading the MDMA trials that got it all the way to federal review so that it could become basically be passed by the FDA for approval as a depression medication. And that got stalled up too. It seems like we're running into a lot of roadblocks lately from what I've heard, what I've picked up on it. But yeah, MAPS does a lot of, I mean, and then there's problematic stuff with it too. I'm not saying that they're saints. I would say pretty much anybody in this industry can appreciate some of the research that AHA puts out there with also calling them out on their bullshit. So it's a little bit of that kind of push-pull.
How many conferences do they have?
MAPS has one big one every 2 to 3 years, I think. But there's psychedelic conferences everywhere. They're popping up in a lot of places. Yeah.
Is it a pretty good turnout?
To my knowledge, yeah, I've only been to one. But yeah, the MAPS conference I think had like 9,000 people there, if I remember, or 7,000. It was big. It was at the Denver Convention Center, and yeah, it was pretty big.
That's crazy. And now that we've talked about it, it'll pop up on my phone everywhere. Watch.
Good. Yeah, it's convenient when that happens.
Yeah, when you happen to be looking up like litter boxes or dog crates or whatever, and now all of a sudden they're everywhere. Awesome. Well, I want to give you the opportunity. I know you have to kind of bounce out, but I want to give you the opportunity to talk about anything that you feel that we didn't talk about, or if you want to do any shout outs or anything like that.
Gosh, I think we covered a lot, actually. I think we covered a little bit of everything, which I appreciate.
Yeah, I try really hard. Is there anything that you would recommend, or, what's your number one advice or go-to for people who are coming into EMS?
Get a therapist.
Okay, number one. That is probably the most answered on my show, is always get a therapist.
Get a therapist. Like, you don't have to wait. Like, you don't have to wait till, you are broken psychologically to get a therapist. Like, they can be there to help you work through stuff proactively. And if you could do that, then why not? If you have there's barriers to care, right?
There's a lot of barriers.
Suggesting it's as easy as like, oh, go get a therapist. Like, no, I get that. If you have access to a therapist, use it, is my point. There's a lot of people who have the access and can financially support it with a low copay or coverage with their insurance, or maybe even, I know a few people who have used their what do they call it?
EAP programs.
Yeah, where and if you can find an appointment that's available, like, I mean, I had an EAP program where I was allowed to leave work an hour early to go to a therapy appointment and still get paid for that hour. Like, take advantage of that.
Yeah.
If you can. Obviously, there's exceptions to every rule. I tell people don't make rules out of exceptions. So just get somebody, work with somebody.
Awesome. Fantastic advice. And where can people find you?
I think the easiest place to find me is on social media at Emergency Resilience. You can go to my website, emergencyresilience.com, to see my online courses. And that's really the big ones, the two big ones. That's where you can find me most days.
And that's ultimately how I ended up finding you. We ended up kind of passing each other's circles multiple times, and I was like, you know what, I gotta have Alex on. I think we're just passing too much. This is kismet.
Well, I appreciate you inviting me on.
Yeah, no, and I appreciate that you came on today. It's been a phenomenal conversation, Alex. I appreciate you so much, and I'm super proud of where you are, and I'm super proud that you didn't let your back injury stop you from becoming who you are today. You are
Wow.
a phenomenal human being.
Wow. Thank you so much. I appreciate that.
Yeah, and don't forget it.
Okay.
And Alex, I hope you have a great day.
Yeah, you too.
Thank you so much. Bye. Thanks for tuning in. If you're enjoying the show and want to show your support, be sure to check out the Noon merch store on Bonfire. Find the link in the description below. Also, if you have any guest suggestions or if you're interested in being a guest on Noon yourself, visit the website at www.samspursuit.com to get in touch.